Earlier this week, President Obama rolled out a new gun control strategy that makes mental health reform a priority. He's pledged $500 million to the effort. But a move to amend a long-standing patient privacy rule in the name of public safety has some in the medical world raising some eyebrows. Fox News' medical contributor, Dr. Manny Alvarez, is among them. Dr. Manny, thank you so much for joining us. We appreciate it.
Good afternoon.
So I want to start our discussion by asking you, are all physicians qualified to diagnose mental health issues?
Of course not. Of course not. The proposal by the president that physicians become aware and if you suspect somebody of having some sort of mental illness, that you need to report them to some federal bureau so that we can prevent people from getting guns. It sounds sort of logical, but it isn't. Not every doctor is qualified to make a diagnosis of mental health. Making a diagnosis of mental health takes a thorough examination. So, I'm an obstetrician. Whether you're talking about a kidney specialist or a cardiologist, we're not qualified to really deal with mental health. That's why you have psychiatrists. Now, the American Society of Psychiatrists says, oh yeah, we welcome this, because sometimes they are also, they want to get involved in identifying risk factors among their patients that may put the public at risk. But so far as having us survey the general population and squeal on people that we suspect that may have a mental disease so that we put them in some sort of list, I don't think that's appropriate. Okay,
I want to play devil's advocate here, because on the other side of the debate, people look at the case of James Holmes in Aurora, Colorado. His doctor, Fenton, did not come through and did not report his very suspicious activity and his declarations in a diary to cause harm to others. Do you think she should have stepped forward?
Well, look, I understand. I mean, look, from a personal, as a father, of course, I wish that she would have gone forward. The problem is that many times in the medical profession, our hands are tied. Right now, if I have a patient that I want to talk to a colleague about, if I'm thinking of some differential diagnosis, in reality, by law, I'm not supposed to talk to another doctor about her clinical case, because I need permission from the patient. This is the kind of the federal mandates. See, this is what you get when there's so much regulation. We never used to have this problem before, but we have so many regulations that have come down through the federal mandates decades after decades, and we end up with more problems at the end of the day. No common sense. We don't let doctors be, just be doctors and create their own sort of portfolio of ideas so that it can, so that society and communities can evolve normally. And this is what you get.
Right. Well, you have an op-ed on foxnews.com. I know you had said, let doctors be doctors. So we very much appreciate it. And for our viewers who want more, they can check it out on foxnews.com. Dr. Manny, thank you so much.
Thank you.